Hey everybody, it's Leila, Health Education Manager here with AiArthritis, reporting back on another session from ACR 2025. And this one is really interesting. It's about oral health in Sjögren's disease and systemic sclerosis. And excited to let you know a little bit about what the session was about. I was very pleased to see that there was a session about oral health in these diseases because I also live with lupus and Sjögren's disease, and I know that oral health is a really big thing in Sjogren's disease. And I've also learned how much of a big thing it is in systemic sclerosis as well. And a lot of people don't know that oral health is health. I'm not sure why dental is separate from medical when it comes to our insurance, because so much can be happening with your oral health that can affect your physical health. And just wanted to go into that and talk about this part of our diseases. And oral health problems are extremely common and under-recognized in these diseases. Up to 80% of people with systemic sclerosis have oral complications, and Sjogren's disease adds severe dryness, worsening damage, and discomfort. These issues are hugely impactful on eating, speaking, socializing, and quality of life. But oral symptoms are under-researched and often overlooked in rheumatology and dentistry. The biggest causes of issues for Sjogren's is dryness, and for systemic sclerosis, it's fibrosis, or the tightening of the skin and facial movement. So, with dry mouth, it can happen in both diseases, but is more prominent in Sjogren's, and this can cause cavities, infections, and painful mouth sores. Fibrosis in systemic sclerosis causes tight skin, limited mouth opening, reduced facial movement, and fibrosis can hide signs of inflammation. So, dentists may miss disease activity when it comes to that. And the combined dryness and fibrosis is much higher risk for tooth loss and gum issues. And a few of the different symptoms that patients should know about and should track with these diseases can be microstomia, which is a small mouth opening that's common in systemic sclerosis, trismus, which is jaw stiffness, dry mouth, difficulty chewing or swallowing, gum recession or teeth becoming loose, burning mouth, ulcers, jaw pain, or TMJ issues, a widened periodontal ligament on x-rays, which can be an early clue of systemic sclerosis, and condyle or mandible resorption, or just jawbone changes in general. And these symptoms can help detect systemic sclerosis earlier. So that should be part of what's being tracked when someone is looking for a diagnosis and think that they might have systemic sclerosis. Oral issues really can affect daily life, make it harder to eat, which can lead to malnutrition, speech changes, which can lead to social discomfort and embarrassment. Dental visits become painful or difficult. Many patients avoid care due to stress, cost, or fatigue, or all of the above. And 61% of patients talk to dental providers, and 39% do not, which is a major communication gap, especially with these diseases. And some dentists sometimes aren't even very educated on our diseases and how much it can affect oral health. And I think patients really deserve to know that a lot of these issues are not cosmetic. It's not necessarily having to do with what you look like or because of that. They're medical complications and literally are impact from what the disease has done to your body. And so, just like joint pain, just like fatigue, just like brain fog, all of these oral health issues should be taken just as seriously. And with Sjogren's, dryness needs special attention. Extremely high rates of dryness due to immune attack and medications. Dryness increases cavities, infections, and difficulty wearing dentures or aligners. Quality of life is huge and often invisible, and managing dryness daily is essential, not optional. And so here's a few things that patients can do from home that can help with the dryness. They recommend using a electric toothbrush, using xylitol gums or lozenges, a night guard if there's grinding, humidifier at night to make the dryness a little less prominent, more frequent cleanings, drinking more water and avoiding acidic drinks, making sure to use soft bristle toothbrushes and non-foaming toothpastes. And what patients can request for dentists to be doing is ask your dentist for shorter, more frequent visits, breaks during long procedures, use of smaller dental instruments if there's issues with the space in your mouth, checking for white patches, fungal infections, ulcers, using fluoride trays or varnish for extra cavity protection, helping to manage plaque when hand dexterity or the jaw opening is limited, and asking them to be aware of any jawbone changes on x-ray. And just being aware that you may need to explain your condition, like I said, because many dentists are not trained in rheumatic diseases. And that's really important to make sure that you continue to self advocate. And even if your dentist does not know about your disease, helping to bring them some information and let them know and how they can help you to increase your quality of life and help you with these symptoms that you're experiencing when it comes to your oral health. And there are a few different complementary therapies that have come about from patients experiencing all of these symptoms. And so, one that I've tried actually is coconut oil swishing, or it's also called oil pulling. That can really, some people have said that it helps with preventing cavities and preventing dryness, using soft trays or orthodontic appliances, green tea lozenges, fluoride varnish that was mentioned before, acupuncture for saliva stimulation. This is something that I was looking into for Sjögren's to try and do acupuncture for dryness in both the eyes and the mouth. And also, if there's a lot of jaw pain, asking about jaw physical therapy, massage, or stretching. And obviously, these are not a cure, but can help to reduce discomfort and improve function when it comes to everyday life. And just as a heads up, there are some medications that can impact oral health as well. There are some biologics that may cause oral lesions, but it's very rare. Hydroxychloroquine can also cause blue-gray discoloration of the gums. And in the study, it says about 44% of people who are on long-term hydroxychloroquine. Some medications can cause dryness, mouth sores, and pigment changes, and pain medications or antidepressants may reduce saliva. So, knowing that there are medications that can impact your oral health, just double checking with your prescriber, whichever doctor that is, to double check if any of these medications can be the ones that are making these symptoms worse. So, just checking in on that and just making sure to see if there can be a change or if there's anything you can do about that medication causing those symptoms. And a few last things. The biggest barriers that patients report, of course, is cost, fatigue, transportation, needing more frequent visits, and competing medical priorities. Cost has been a really big thing. Before I even knew that I had Sjogren's, I had to pay $5,000 over a few years out of pocket for constant cavity fills, root canals, what's it called? The little caps that go on there that cover the root canal. It just gets so expensive when your teeth are constantly having issues because of dryness, and dental insurance doesn't really cover that much when it comes to all of those things. And it's really frustrating because money has to come out of nowhere to get all of the care that's needed sometimes when it comes to oral health. And they are working on, like, for Medicare to have some of these things that are Strogan specific be covered under an ICD-10 code so that medical insurance can help cover it. But that's really only for Medicare that things are being done. And it's really frustrating for the regular population to have to continuously deal with this. And it does cause patients to ignore their oral health because there's more pressing things like your joint pain or any other issues that may be going on in your body. And people know that you're going to come out of there with a huge bill. So some people just avoid going to the dentist overall, which obviously can cause more issues. And a few key takeaways would be that oral complications and systemic sclerosis and Sjögren's are medical, not cosmetic, and giving the patients the peace of mind of knowing that and not feeling bad for really wanting to address these issues. Managing these symptoms early can improve eating, speaking, pain levels, show social comfort, and long-term dental health. Patients should feel empowered to advocate at dental visits and ask for modifications. And rheumatology and dental care need to work together, and patients should not have to bridge that gap alone. So, any resources that your rheumatologist can help you provide for your dentist, you can ask for that. Finding it yourself, giving any breakdown of your condition can really help the dentist to see what they can do to help you. And again, just like finding any other doctors, if the dentist that you're with does not seem compassionate, does not seem empathetic about how much your oral health is being affected by your autoimmune disease, specifically systemic sclerosis or Sjogren's, it's okay to find a new dentist and see if there's somebody else out there that really is willing to help. And yeah, that is a little bit more about oral health when it comes to these diseases. And really, again, glad that we're able to see some attention being brought to this side of these diseases because it really is very uncomfortable, costly, and sometimes detrimental to health for these patients. Thank you again for being here with us for Go With Us, and I hope you enjoyed this video. If you have any questions, comments, please feel free to comment on this video, and we'll talk to you later. Bye.